Hello everyone, I'm Sharon Gaynor, Training Research and Development Assistant with Haven Horizons and Knowledge Broker on the Community of Practice. Today we are delighted to welcome Kelley Bermingham from St Patrick's Cathedral to discuss her work. But before I hand you over to Kelley, you're all very welcome as usual, but a special welcome to any of our new members and those joining the Lunch and Learn for the first time. Just a brief run through the format. If anyone has any questions during the presentation, you can put them into the questions and answers in the chat section, and we will upload anything to the Community of Practice afterwards. We may get to a few at the end, but otherwise they'll be uploaded. And I will just give a very brief community update after Kelley has presented. Kelley Bermingham is employed as the Community Liaison and Safeguarding Officer in St Patrick's Cathedral, Dublin. As a social care worker, Kelley has formal training in social care, community work, mental health, youth work and facilitation. Kelley also has a long history of voluntary work beginning in her home, which was where the Alone organisation was started by her parents, with the office at the heart of their home. Kelley's community experience includes active involvement in the Irish Red Cross, the annual Kildare Derby Festival, Kilmainham Arts Festival, community radio and youth mentoring, in addition to working with the Ivy Trust in the delivery and management of quality housing for community members. Kelley will be sharing some insights with us today into her community work, both on a personal and a professional level, demonstrating the importance of understanding domestic, sexual and gender-based abuse and being trauma-informed when working in the community. Also, the importance of collaborating and making connections with other professionals to provide the best possible support and responses to victims of abuse and vulnerable members of the community. So, Kelley.
It's lovely to meet you all. And while I'm going through my presentation, I'm not going to use slides, so I'm much more of a conversational type of presenter. And I suppose one of the things is, if you have questions, if you type them in, I'll try and incorporate the answers into the presentation live rather than wait until the very end, because you might have a burning question that I'd be able to answer live, and that becomes part of the presentation for anybody who views it later on. And I suppose maybe even afterwards, if questions do arise that you've mulled it over, don't be afraid to drop them into the chats. And I suppose Sharon already kind of referred to the fact that my home was a bit of a madhouse when we were growing up. We had everyone, whether there was furry, feathered, legless, or two-legged, or four-legged, it would arrive at our door if there was anybody in bother or in trouble. And it didn't matter whether that was young or old. And quite often we would have had a lot of people who would have been banished from their home. This was before the Alone organisation started. My mother used to take in unmarried mothers who were literally ready to go to the Magdalen laundries at the time. So that's given an indication to my age. But I suppose it literally was a house where everybody was made welcome, and those ladies would have come and stayed with us until they had their child and either gave their child up for adoption, or maybe my parents would have set them up with the flat and perhaps a small job to have some income and some supports until they got themselves on their feet, and then continued to support for a year or two or a couple of years, however long was needed. And in fact, some of them, I think the last girl left our house in 1988 or 89. And so that continued even after Alone had started. So it gives some indication as to the breadth of my parents' approach to social justice. So I was used to people coming and going all of the time. And I remember one of the very first cases of domestic abuse that I would have been aware of. I was about 12. I was already in the Irish Red Cross as a volunteer, and it was New Year's Eve, and I had a lady who had come to our house who was a regular, an elderly lady who was not from Ireland originally, so she had no other network or community, and she arrived black and blue, eyes, nose, cheekbones fractured, and she'd been violently raped by her housemate. And she was in a very bad way. And my father, we were having a party in the house, which wasn't unusual either. We would always have any reason to celebrate, we would take it. And so discreetly, she was brought upstairs to my bedroom, and I got my first aid kit out. My mother excused herself because nobody else at the party knew what was going on. And just to preserve her dignity and give her a little bit of privacy, I was treating her wounds with my mother and helping to bathe her and get the blood out of her hair and all that kind of thing. and she disclosed what had happened to my mother in broken English, and she wouldn't call the guards. She wanted to just keep it all very quiet and was very embarrassed, and her biggest worry was where she was going to be buried. So she's now actually buried with my parents. And that was an offer that was made that night. Now, incidentally, my father's proposal to my mother was, how would you like to be buried with my people? So, you can see that there's an inclusive approach to these things. But she is interred with my parents. And that was my first time being aware of the violence of somebody that you could be living with. And then maybe a year or two later, one of my best friends from school was having similar experiences in their own home, and it was alcohol related. And her family, her mum and all her siblings came to live in our house for a period of time until they returned, because they really didn't have much of an option otherwise. So they were early indications of ways to respond, ways to resolve from a community perspective. We were just a family living in an area, responding to people that connected with us because we were a solution house. So fast forward into my social care training, there was never any discussion around domestic violence. It was always around crime, and at the time, crime was only to do with larceny or arson or drug dealing. And heroin had really come into Ireland in the 70s, and this was into the early 90s when I was in college. So the focus was always on those kind of crimes, and there was never any discussion around domestic abuse and never any recognition of it. And that was right up until 1995. It was not a feature in any of the programming for social care. And so whilst I had an awareness of all the refuges around the city, one of my first thesis actually was on the increasing levels of violence against women. And my lecturer said, there's no evidence to support that. And I went, well, if you look at the newspaper, here's some evidence that I can present. And I still have all those notes from my studies back then. And the lecturer basically dismissed it because there wasn't sufficient academic research done into it at the time. And I was actually horrified at that, because I knew from on the ground experience that there was a lot more of this going on than was being recognised. I remember the Rathmines Refuge going back to 1993 or 1994, and it was in its infancy. I think, even though in today's context, in terms of the formal supports, there was a lot more informal response to domestic abuse, and a lot of it to do with shame, embarrassment, and the lack of willingness to discuss it openly. Secret locations, people not wanting anybody to know where the refuges were, terrified that the perpetrators would find out where they were. But there was no legal solution or recourse at the time. So I'm really hopeful in the fact that in the past 30 years that we have seen a huge advancement. And if what has happened in the last 30 years can be accelerated to a similar level, hopefully in 10 years' time, we can mitigate and respond differently. And with our trauma-informed care training, we can be much more strategic in how we respond. So as to where I'm now working, I suppose I worked in mental health for about 15 years in the health service and survived. I'm out the other side of it, and I loved my work there. I loved working with people that had mental health difficulties, but many of them would have experienced domestic abuse. Some of them may have even been domestic abusers themselves without even realizing it, because they didn't understand their own dispositions and had no emotional regulation capabilities and so on, and they would have struck out because they were experiencing psychotic symptoms and so on. So they became abusers in their own homes. And through the personal development programs, I suppose I would have engaged with people on how to regulate themselves, how to increase their levels of awareness, but not in any formal way. It was very much occupational services that I was working in, some of it employment focused and training focused, but just trying to highlight areas and direct them to services who could provide more formal solutions. But again, there was nothing within the formal recognition of those tendencies for people in how to direct them to solutions for themselves. So very informal whilst within the work role. I would have actually dealt with a couple of disclosures over that time, some of them related to domestic abuse, but more of them related to sexual abuse. Where I'm working now in St. Patrick's Cathedral, all of those little experiences have contributed to who I am, where I am, and what I get to do. I have a great privilege here in that I get to shape the role in light of the skills that I have and the breadth of skills that I have and the communities that we get to meet. So I'm also safeguarding officer as well as community outreach. I work very much in partnership with other organisations, including the Child and Family Support Network, the likes of YMCA Dublin, Dublin City Council, the Public Participation Network, and Garda Síochána in the local area, through the A district and beyond into the G and the B and the C. For those of you who are guards, you'll know where those districts are, but it's basically the city and city centre and beyond. For a period of time during COVID, I was initially, for the first 12 weeks of COVID, I was relegated to home. And I was trying to reimagine, how does community look for people that you can't be with? Because to commune is to be with people. Community means unity with people when you're with them. And when you're relegated to home, how does that look? How does that feel? And I was looking at, how can I best be of service right now? So my style of leadership would be servant leadership. And I was looking at people who were homeless. They were being addressed immediately. There was people taken off the streets, put into hotels, which are suddenly empty because we had no tourists. And then we also had the people who were elderly were very highly focused upon, because they were the highest risk category of individuals when it came to COVID-19. But the third group of people were people who were at home, for whom home was not a safe place. And because of my experience prior to this, I was aware that this was definitely an area that was going to be a hotspot. And I contacted Safe Ireland, and I can only say that the partnership with them was just incredible. Dublin City Volunteer Centre, Edwina Dewart was the manager there at the time, and myself and Lisa Marmion from Safe Ireland triangulated our services along with Garda Síochána to respond immediately to whoever was presenting to our services in a way that was creative and involving volunteers from home. So Dublin City Volunteer Centre had an embarrassment of riches, a lot of people at home wanting to do something but not knowing what to do, not being allowed to leave their homes, and so we had to imagine ways for them to come together. So I contacted our neighbours here in the Ivy Trust, and they had a premises up on Cork Street, and they gave me the room there, community room that wasn't really in use at all, and hadn't actually been activated as a community space for the 10 years that it was in existence. It was in the ground floor level of a new apartment complex, and it had a roadside entrance. So we created a drop-off point for Thursdays and Saturdays for these volunteers to respond to 3 requests. The first of those requests were practical things. So we had home starter kits for people who were fleeing home for the first time and literally walked away with whatever they had in their hands and whatever they could carry on their backs. We had a request for people to provide spare homes. Now, we didn't get very many of those because a lot of them, people wanted to offer spaces within their own homes, but that wasn't appropriate. And then the third request was letters of hope and courage to support people from a distance, that when you maybe didn't have the means to give something to somebody, that you could perhaps give some hope and words of encouragement. And in fact, an awful lot of those letters came from people who are survivors, and they were wishing that people who were emerging in the early stages would understand that you will get through this. And so those letters are being compiled into a book at the moment, which we'll be publishing later this year. So I suppose that kind of gives an idea of some of the things that I get to do. I have had disclosures here on a number of occasions, both in terms of people who are volunteers, members of the congregation, and random strangers. And one person was a volunteer on the Criticall project. And Criticall is an acronym for Community Response Team Call. So that it was critical that we intervened in the best way that we could. And we used to get the guards to do all the deliveries, and we had food program as well. So we did food cloud, and I suppose it's practical responses. And then we stood that project down as soon as the services had rallied and come around to normal operations, to be able to flex into the emerging needs that obviously since COVID, there's been so much change, so much awareness building. So if somebody comes to me now in relation to domestic abuse or anything similar to that, I would have already had a baseline, but now, because of my experience through Criticall, I would have been in court as a witness on a number of occasions. I've been making statements and making referrals, but actually linking people strategically with the services most appropriate to whatever they disclose to me. Some of them are mandated reports because they involve children. Some of them are more adult orientated in terms of adults at risk, and we're in the process of developing a bespoke adult safeguarding program here, because we are a national cathedral and we've 600,000 visitors a year. So people come from all over the world, and oftentimes when they come into a cathedral space, because it's maybe the first time that they're somewhere that allows them to sit peacefully and think their own thoughts, and they can't be really on their mobile phones, or they're maybe sitting at a service. Sometimes things come to the surface that are unexpected, and if we have ways of signposting people, then that's our purpose. And so we stand into that where possible, and we've information, we have leaflets, and I'm available to speak to people if they need to talk to somebody. And we also have 2 deputy DLPs on the team, but I provide all the adult safeguarding and child protection training in the cathedral for our 80 staff and 130 volunteers. So there's quite a breadth of reach that I have. It's quite a unique and privileged position, but we also have the funds to seek consultants who will come in and speak specifically to areas of need, such as the safe haven training for faith communities. And safe haven training is directed at people who are new to Ireland. And as you are probably aware, the more isolated a person is, the less likely they are to be able to resource themselves with supports that are strategic. So I'm conscious of time, and it's 1:32 on my clock here, so I don't want to ramble on too long, but if you have any specific questions or anything that I can help you with, or if there's anything that's not clear about what I've spoken about so far, I suppose feel free to shoot the questions across to me. Yeah, and I think part of it is that it'll also be peppered with, between letters, there'll be pages of support for, we're going to separate it out into the seasons. So that's part of the design concept. So as well as that, we'll have the different services spotlighted and what makes each service unique in terms of information for people who need to access those supports. And we'll be making it available in relation to digital format that people can download it to their phone, and we make it freely accessible. It's not going to be for sale. It's a free desktop book. So we'll have 600 physical copies, and then the rest will be digital. So we want to have one in every Garda station in the country, one in every refuge in the country, and we'll definitely have copies here in the cathedral as well.
That sounds brilliant.
I see a question there in relation to an increase of disclosures re domestic violence. Absolutely. I would say in the last month I've had 3, and that is, unusual for us because we're not a domestic violence service. So, and when I say us, as a cathedral, but I also have other parishes because I'm on a number of panels. So I'm on the Council for Mission for Ireland. We're the national cathedral, so we have a national platform. And quite often I'll get calls from parishes around the country because the word is out of what we do and how we do it. We have a different approach, I suppose. And we're also different in that we have resources for training, we have resources for staffing, where parishes rely entirely upon volunteers. And to be quite honest, they're in the dark ages when it comes to it because it's an ageing congregation. So they don't have the training and the awareness. They don't know how to link in or collaborate with the likes of the child and family support networks. But showing them and signposting them to where the solutions exist within their own communities is something that I assist parishes to do. So that's seeing an increase in awareness building, I suppose. And there's also the Mothers Union within the Church of Ireland, and that's a group of active women who are engaged in the community. And there's a lot of knowledge, but they don't know what they know, if that makes sense. They know each other as a parish community, and a lot of people just go, sure, that's just Mary, and that's Mary's experience, and that's how their family roll. But actually, it's not okay, it's dysfunction. And so it's recognizing that it's dysfunctional, but it's also recognizing the solutions, and it's recognizing the strengths that people have to be resilient and to cope despite the difficulties that they're experiencing. So that was emphasized actually in the training that I did with Women's Aid recently on responding to domestic violence in the community. and recognizing people's strengths focused, looking at how resilient people are, how they manage despite all the financial controls and all the limitations that are placed on them, the boundaries, the isolation, or the lack of boundaries, the shame mongering that goes on. So it's how to mitigate that and how to support people to feel safe enough to talk about what's actually going on and to gently support people. Because the last thing you can do is roll in and go, well, I think you're having this experience. You know, people have to recognize it for themselves. There's a support, I suppose it's like a ripening of the mind. And when you kind of signpost different services and articulate what it is that the services do without saying this is a service you should contact, what you're doing is you're highlighting, you're educating, you're raising awareness, but you're also engaging people with solution focused thinking. And if it's a time that they realize, gosh, that's something I actually need, well, you never know. So, for instance, one of the people who volunteered on Critical recently came forward as somebody who was experiencing it and hadn't recognised it. And yet they were volunteering in a programme that they felt strongly about, but they didn't realise why they were feeling strongly about it. And it has taken them 3 years to come to the point where they're now in a position to discuss and disclose fully what it is that they've been experiencing. So that just gives you an example of the timing. And I suppose as communities, parish churches, parish communities, they're the epicenter for people where they're usually in a quieter space where they can, if the space is right for them, if the cultivation of that culture of openness is done carefully and managed carefully and responded to carefully, everybody has the capacity to be a player in that audience of people who can be solutions and signposters.
That's very well put, Kelley. It's excellent because, again, what you've said there, I love that, the ripening of the mind, because not everybody is aware. As you said, you could be working with it for years and you don't realise, you don't recognise your own situation because you've had to manage that for so long that you've just deny, minimise. So I think that is a very important one. And the fact, as you're saying, the training has to come for everybody to be able to respond effectively. No point in somebody coming in and saying something and then not knowing what to do or how to help that person. It really is so important. And this is why we're always trying to push that out there, training and education, everybody across the board, you know, so that anybody will understand, whether it's a friend, a neighbour, person coming into your workplace, whatever situation it might be, that we know exactly who can help and where to direct them.
And even, you know, in each parish or each community, to encourage each service to do an audit of their own community to see what does exist in your community as a set of resources, no matter what the issue is. So if you have a list of services that are localized, you have a first name contact. Like as DLP, I will never refer somebody. I will sit down and make a phone call with that person and then hand the phone over and go, this is Josie on the line. She's going to help you now. And I'm going to leave you to have that conversation. So we have a strategic way of, rather than just going, off you go now, make your phone call and leaving them to their own, because it's so distressing. It's so terrifying when you're seeking support. Maybe you're a person who's never had to seek support for anything before, that you've never had to ask for anything before. You don't necessarily know the questions to ask. You don't know the services to engage with. You maybe never had to visit a citizens information office. You've maybe never had to go into the bank to, you know, disengage an account or to how to go about doing those different things. So there are services there that support people like MABs or different advocates who will go along and support somebody who's going into that kind of a challenging environment. And I think one of the things that only recently came up, now it's not a new thing, but I suppose there's a lot of people who do not have competency in literacy. And those people are extremely vulnerable in our communities. Imagine somebody going through the school system and coming out the other end of it and they cannot fill out a form. And that is extremely challenging. So having this, I suppose, the EQ to be able to recognize this person is avoiding a form filling. Maybe they need assistance with it. Maybe they need somebody to sit down from maybe Fighting Words or one of the other charities that helps people with literacy difficulties and breaking something down into very simple English. NALA is the National Adult Literacy Association, and they have a program of simplifying language for form filling, for policies and documents that are available. Lots of documents have acronyms in them. They're, they're written for an audience who are competent in the field, but they're not necessarily written for somebody who's trying to engage with something that's new to them. So having the simplified version is fantastic, not only for people who have literacy challenges, but imagine people for whom English is not their first language. And when we phrase something in a particular way, we're making the assumption that everybody gets it. So even to use an example that was shared with me yesterday, somebody who was speaking about biodiversity said, oh, we don't need to define biodiversity. So let's just make sure that, everybody out there knows what biodiversity is. We're just going to have a chat and we'll start from there. And the person hosting the meeting said, I would like everybody to write down their definition of biodiversity and let's compare notes. And not one definition matched. So everybody has a different level of engagement with a definition or with a particular phrasing. So what we need to do is make sure that everybody understands in very simple plain English what it is that a service can do or provide and what a term actually means. And as people working in a field of a particular expertise, no matter what that field is, one of the shocking things is that we always assume that everybody gets what we're talking about, but you have to put yourself in the shoes of the person that's your audience in that moment. And I remember being my first court case going back to 2000 in relation to child abuse. I was the first person that a disclosure was made to in a particular case, and there were quite a number of people involved in it as witnesses, and the term victims, now survivors, but I suppose they were the first person to disclose was a 15-year-old, and all of their siblings had experienced a similar experience, and I was then the translator for that family because there was nobody who was in a position to be able to translate what the DPP were doing, what the guards were doing, and how to navigate the legal system. So it was totally new to these people that had never set foot in a courtroom for any reason whatsoever. And they were entering into an arena that was just confusing and all about them, but not with them, if that makes sense. So I actually went into college to study law for 2 years. I did the ILEX course in Griffith College so that I would understand the landscape I was stepping into, because it was a whole other language and I had never engaged with the legalese. I'd be fairly articulate. I used to chew up the dictionary just for the crack. One of our tasks as children, my dad used to hand us the newspaper and say, read page 6 and find the mistake on it. And it'd be a broadsheet and you'd be reading until you found a grammar mistake or something silly in it that he would have spotted, but it was hard to find. So I've always been a bit wordy. So I love language, I love expression, but I love to be able to break it down so that if it is something that seems confusing, that you can actually simplify it. And that helped that family to navigate the system of entering into the witness program, of engagement with the court, engagement with the guards, engagement with the victim impact statements and so on. And I wasn't an expert, but I was just the person they trusted at the time. And I don't know what it was. It was tell Kel on my forehead or something that just, I am that person that people tend to kind of come to, whether it's at home or in work, because they just know that I'd have a network of people. Because I think my sister was a bit shocked the other day. She was looking at my phone and she saw there were like 9,000 contacts in the phone. And she said, that can't be right. And I said, yeah, it is. And she was like, no, you can't be connected to that many people. And I said, well, there's probably about 30 Patricks and about 40 Sineads and 20 Sharons and the whole lot. But I have a note beside each name as to who each person is, because otherwise I wouldn't be able to keep track of half the people. So if I'm looking for somebody in a particular program or a particular service or with a particular skill, to use the Liam Neeson phrase, a special set of skills, I will find them, and I'm resourceful that way. So yeah.
Kelley, that was incredible. I'm just sorry because I'd love to stay for longer. I'm conscious we've gone a little bit over, but that was really, really incredible. There's so much in that, to unpack. You've touched on so many different issues. Again, it'll be brilliant to have the recording there now, listen back to that and actually break it down. And if anyone has any questions, that will go in, to the presentation at the end. Feel free to share your thoughts or ask questions.